So I'm Dana Obi, and I am a certified dental assistant, and I'm in school currently in Washington State to become a dental therapist. And then once I go to Michigan, I will be a licensed dental therapist. I have been a dental assistant for 13 years, and I started just as a standard dental assistant. And then I wanted to go back to school, so I became certified. And then I was going to go on to be registered as well, which is like another tier where you can perform extra duties to help patients. A dental therapist was actually designed so that there were more providers in a rural area. So anybody who was native could go back to their tribe and then perform as a mid-level provider and do these restorative dental treatments. Dental therapist is more there for the kids and like building a relationship with the children, and more so for the education part of it and the interaction. Naturally, I wanted to help people, but knowing that I can go to other local tribes and they can have another Native American work on them, I think that that's going to open up a huge door for acceptance when it comes to getting dental care done, because so many of our tribal communities, like their members won't go and see a dentist because they have had such terrible experiences. Like there's something called historical trauma, and I think that stopping that or having something to do with stopping that process would be amazing. And I think that I can do that as a dental therapist. I think that I have that ability to go back to the tribe and help the young kids. It's taught in like a trade school environment. So you have that option where you can go and do like a short program, like a 1.5-year program, which is what I did. And it'll teach you the basic tools that you need, but mostly a lot of it comes with on-the-job training. If I were to do it again, I would go through one of the community colleges, and then you could go and be a dental assistant, and then you could become certified. And then you could go on to be a registered dental assistant as well. So there are different tiers to it, so you can expand your functions. So there's a private practice setting, and then there's also public health. And I was in private practice for a long time. I moved on to public health, and I love it. It's unbelievably different. Public health is where most of the patients who come to us only have state insurance. And these are patients that may have never seen a dentist in their lives. So it's really about educating everybody. So their caretakers, their parents, them, if they're competent enough to understand the desire is there, they don't have the tools. Everything that we do utilizes motivational interviewing. And it's basically getting patients to speak about some of their fears or concerns without making them feel uncomfortable. And that's really the biggest part of it, is just learning how to assess the situation where you can figure out where to start with that person, and then teaching them the things that they need to know, but on their terms. Dentistry is just a really big family, and it's nice to be a part of it, and it's like its own little world. Honestly, it's really great because you get to help people. You get to learn every day. You learn something new, and then also you're not doing the exact same thing every day. So dentistry has multiple different procedures, and you get to wear many hats. You get to be the dental assistant, you get to be the sterilizer, you get to be the x-ray person, you get to be the front desk person, you get to be the cleaning lady. You get to do all of those things. All of the weight isn't just on you, because it's the entire team that makes the office work. yeah, it's just part of like a community, I guess. But it's really great to help people.